Is being alive just having a heart that beats or the limbs that move? Living without dignity is painful. Seeking an opportunity to share our abilities appears to be the way forward to support the quality and the dignity of life. Every day, SVYM's palliative care team sets out with this mantra. On their way, traveling with like-minded people who bring along their unique abilities to provide holistic care for the vulnerable. Shweta is a very sweet child. Our team makes a routine visit. She is now able to greet them with a hello. Her ability to express her needs and more often her affection has greatly transformed how her mother cares for her. It is also an evolving experience for other caregivers. This newly learned ability has brought out the person in Shweta that others couldn't simply see because of cerebral palsy.
Often people will not get access to palliative care. To get any sort of care, the very much vital thing is communication. So we are ensuring that to get any sort of care, we need to stabilize their communication. So with the help of speech therapy, with the help of any sort of hearing related problems, we are giving them opportunity, or we are giving the caregivers and family to ensure that they are getting this access.
Our collaboration with JSS Institute of Speech and Hearing has helped in voicing unspoken moments of gratitude and love. In a different alley, we are joined by Suchita. Suchita has returned to care for her aunt, who is battling kidney failure and hearing loss.
ಇವ್ರು ನಮ್ಮ ಆಂಟಿ. ನಾ ಇವ್ರ ಮನೆಯಲ್ಲೇ ಇದ್ಕೊಂಡು ನನ್ನ ಎಜುಕೇಷನನ್ನು ಕಂಪ್ಲೀಟ್ ಮಾಡಿದೆ. ನಂಗೆ ಜಾಬೂ ಕೂಡ ಸಿಕ್ಕೈತಿ. ಈಗ ಅವರಿಗೆ ಹುಷಾರಿಲ್ಲ. ಅವ್ರನ್ನ ನೋಡ್ಕೊಳಕ್ಕೆ ನಂಗೊಂದು ಅವಕಾಶ ಸಿಕ್ಕೈತಿ.
The involvement of family as primary caregivers reduces the burden of care on the healthcare systems. It opens an opportunity for us to evolve as better human beings and brings a degree of dignity that makes life bearable. Being alive is a felt experience. Holding one's hand to share your affection and care is an extraordinary human experience which our volunteers know by lending their abilities in this process. For Gauramma, from being bedridden to walking on her own after a stroke has many invisible hands supporting her in regaining her ability to balance. The feeling of being upright is one of the most fundamental to being alive.
Palliative care is going to be a necessity. It is, we cannot proceed without palliative care, and we need more doctors joining the effort. Like, as we have one of the most aging and aged populations, we are a populous country, we have to see that it can be supported. Patient can have a greater degree of comfort if we as doctors provide inputs as volunteers.
The circle of care expands with collaboration that brings unique abilities to make palliative care holistic. Our collaboration with Dim Hands has brought the right skill and reach in making palliative care more inclusive, be it cancer or managing mental health.
Palliative care in psychiatry is a new term. Although palliative care in other conditions like cancer, neurological condition is well heard. But palliative care in psychiatry although we are hearing it of now, we are happy to have that in our institute along with the SVYM NGO. So in this, what we are doing is, many of the psychiatric patients who are not improving completely, so they require a palliative care. So most of them are residing in the community and they may not reach the hospital. So we are going to community along with the SVYM, going at their doorstep and assessing them, and whatever is required for them, like distribution of the medicine, counseling at their doorsteps, we are doing that.
Palliative care is a life skill that everyone should have. Volunteers are the backbone of community-based palliative care. Will you please join us?